A remarkable tribute to a man blessed to have lived to see 100 years, and 50 of those years committed to the medical fraternity from humble beginnings.
His father worked as a gold miner at Tough Mine in Johannesburg. He worked as a kitchen boy, doing chores such as cleaning the house before going to school, making breakfast, and washing dishes for his Afrikaans teacher and his wife. The late Oliver Tambo was his mathematics teacher at St. Peter's Secondary School.
He was so active in the profession. He used to read a lot, study. He used to go for medical conferences up to the age of 90, but we felt at 90, no, he deserves his rest. And we struggled with him to get him to retire, having to take the car keys away, having to tell his patients he's no more available to help them.
It was in 1989 when the first HIV case was recorded in Lesotho that Dr. Makenete championed the cause for prevention of HIV transmission through practice in safe sex. He further played a crucial role in formulation of health guidelines and formal regulatory bodies.
We worked together with Dr. Makenete's guidance in the formation of the Lesotho Nurses Association and the Lesotho Nursing Council, meaning that Dr. Makenete was the first chairman of the Lesotho Nursing Council.
It is very touching to know that Dr. Strong was a minister at the time when the first HIV/AIDS patient was identified, and he went about setting up systems that made it easy for those of us who came after him to deal with HIV and AIDS. And as you know, Lesotho was a trendsetter in many, many things. We were one of the first countries to offer HIV/AIDS treatment in the public sector, not only in the public sector in the hospitals, but also at the clinic level, offered by nurses.
The professional and personal career of Dr. Makenete paints a portrait of an exceptional human being, and this is something that all of us want to emulate.
And while his strong ethical conduct often led him on a collusion path with powers that be in governments, to date he remains a standard to what and how public health should be.
He served this country. He was dedicated, hardworking, disciplined, and principled.
And those in the medical fraternity know what entanglement is, especially when you're on campus. You stroll into Dr. Makenete's surgery, wounded. And Dr. Makenete, he looks at you and says, but he doesn't actually say anything. He just looks at you. And that look is enough to say, young man, what in the whatever have you done? But professionalism, dedication, is something that I think all of you young practitioners are taking away from this memorial service.
Rapelang Radebe, SABC News, Maseru, Lesotho.